To truly understand shame, we must first explore its roots. The word shame traces back to the Old English schema, meaning a painful feeling of humiliation or distress caused by the consciousness of wrong or foolish behavior. Throughout history, scholars and practitioners have delved into its complexities. I'm Sinta Ebersohn, and if you're wondering why I'm talking about shame, it's because of the direct link to how we process our traumatic experiences and adversities, and that determines the degree of post-traumatic growth we can achieve. As a post-traumatic growth specialist, my passion is to provide you with as much information as possible to guide and support you towards the incredible personal growth that life's hardships offer you. Please like this video, share it with one person who needs to understand shame, and subscribe to follow all my discussions. There are many theories about shame, so let's briefly look at a few of them. Freud introduced the concept of shame anxiety in the late 19th century, linking it to a fear of disapproval from authority figures. According to Freud, shame arises when individuals internalize societal norms and expectations, leading to feelings of inadequacy and self-consciousness. Carl Rogers emphasized the importance of self-congruence in the mid-20th century. He believed that shame arises when individuals' self-image conflicts with their ideal self, hindering personal growth and authenticity. Rogers advocated for cultivating unconditional positive regard and self-acceptance to overcome shame and to embrace vulnerability. And that brings me to Brené Brown. Her research on vulnerability and shame in the 21st century revolutionized the conversation. She emphasized the power of empathy and self-compassion in overcoming shame's grip. Her work highlighted the importance of embracing vulnerability as a pathway to connection and wholehearted living. It challenges societal notions of perfectionism and invulnerability. Then there is Albert Bandura, who proposed the concept of self-efficacy, which refers to an individual's belief in their ability to succeed in specific situations or accomplish certain tasks. In relation to shame, Bandura's theory suggests that low self-efficacy can contribute to feelings of shame, as individuals may doubt their competence or their worthiness in certain areas of their lives. Madeleine Klein, a psychoanalyst, expanded upon Freud's work and introduced the concept of a good breast and a bad breast in infancy. According to Klein, feelings of shame can develop early in life when infants experience frustration or rejection from caregivers, leading to internalized beliefs of being inherently flawed or unworthy. And then there's Judith Lewis Herman, a psychiatrist and a trauma expert who developed the concept of complex PTSD, post-traumatic stress disorder, and identified shame as a central component of trauma-related disorders. She emphasized the role of shame in inhibiting survivors from seeking help or disclosing their experiences, perpetuating cycles of isolation and self-blame. This should give you a more comprehensive understanding of the multifaceted nature of shame and its impact on mental health and well-being. Our modern understanding of shame is a complex interplay of social, psychological, and emotional factors. And over the years, I've seen how shame manifests across various dimensions of the lives of my clients. So here are some examples. Emotional shame can happen when you're experiencing shame for having emotional needs or vulnerabilities, such as seeking reassurance or support from others. It may lead to suppressing emotions and avoiding intimate connections out of a fear of rejection. Feeling ashamed of expressing joy or happiness, especially in the face of others' suffering or adversity, can also result in feeling guilty for experiencing positive emotions and difficulty in fully embracing moments of joy. Experiencing shame for past emotional outbursts or reactions may also lead to self-criticism and difficulty in forgiving oneself for moments of emotional dysregulation. But let's look at environmental factors. Feeling ashamed of living in an unsafe or unstable neighborhood can lead to social withdrawal and reluctance to invite others into one's home due to a fear of judgment or stigma. Experiencing shame related to environmental impact or sustainability practices, such as not being able to afford eco-friendly products or participating in activities that harm the environment, may also lead to feelings of guilt and inadequacy in contributing to environmental conservation efforts. Feeling ashamed of clutter or disorganization in one's living space can impact self-esteem and confidence in hosting guests or participating in social gatherings at home. In the family context, experiencing shame related to family secrets or dysfunction, such as addiction or abuse, can lead to a sense of isolation and difficulty in seeking support from others due to fear of judgment or betrayal. Feeling ashamed of familial roles or responsibilities, such as being a caregiver for a family member with special needs or financial dependence on family members, may also lead to internalized beliefs of being a burden or a failure. And then experiencing shame related to family estrangement or conflict can impact profoundly on one's sense of belonging and identity. And this can lead to difficulty in forming and maintaining healthy relationships outside of the family unit. On a financial level, feeling ashamed of financial struggles such as debt or bankruptcy may lead to avoiding seeking assistance or support, exacerbating the situation. Experiencing shame regarding one's career or job status, such as being unemployed or working in a lower paying job than expected, can contribute to feelings of inadequacy and low self-worth in financial matters. And feeling ashamed of perceived financial failures, such as overspending or making poor investment decisions, may also lead to self-blame and reluctance to seek financial advice or assistance. Mentally, experiencing shame that is related to mental health challenges, such as depression or anxiety, may result in reluctance to seek treatment or reluctance to disclose struggles to others due to a fear of judgment or the stigma that is often attached to it. Feeling ashamed of past mistakes or perceived shortcomings in intellectual abilities, such as academic failures or difficulty learning new skills, can impact self-esteem and confidence in mental capacities. And experiencing shame related to traumatic experiences or mental health diagnoses may lead to internalized beliefs of being flawed or unworthy of love and acceptance. Feeling ashamed of one's physical appearance or body image may result in avoiding social situations or activities that involve exposing oneself, such as swimming or going to the gym, for example. Experiencing shame related to physical health conditions or disabilities may lead to hiding the symptoms or avoiding seeking medical care due to the fear of being perceived as weak or inadequate. And feeling ashamed of past or current substance abuse or addiction issues can contribute to feelings of self-disgust and unworthiness, perpetuating, again, destructive behaviors. Experiencing shame related to social status or perceived social failures, such as being single or not having a large social circle, may lead to feelings of loneliness and isolation. And feeling ashamed of family dynamics or conflict can impact relationships with friends and acquaintances due to the fear of judgment or rejection. Experiencing shame related to social anxiety or difficulties in social situations may also result in avoiding social interactions or withdrawing from social activities altogether. What about a spiritual level? When you're feeling ashamed of your religious or spiritual beliefs, that may lead to an internal conflict and a sense of alienation from religious or spiritual communities. What about experiencing shame related to moral or ethical transgressions? That can impact one's sense of connection to higher principles or values, leading to feelings of guilt and unworthiness. And feeling ashamed of doubts or questioning one's faith may result in suppressing spiritual exploration or growth out of a fear of judgment or condemnation. When it comes to our jobs, our careers, or our vocation, when we're experiencing shame related to career setbacks or failures, such as being passed over for a promotion or being laid off from a job, made redundant, that can impact self-esteem and confidence in our professional abilities. Career choices or paths that diverge from societal expectations or family feelings can lead to experiencing shame and feelings of powerlessness and injustice, and that impacts our job satisfaction and our performance. So as you've seen, shame's impact is far-reaching and profound, but there's a silver lining. By understanding and addressing our shame, we can unlock tremendous growth and resilience. And a great safe place to do this very personal work is my online Get Up and Grow community, where you'll find a wealth of information, guidelines, courses, events, and other incredible resources to support you along the way. Go check it out and sign up today. There are several commonly used mental health processes or therapies for addressing and working through shame. But let me tell you about 3 of them. Cognitive behavioral therapy, or CBT, is a widely used therapeutic approach that focuses on identifying and challenging negative thought patterns and beliefs. In the context of shame, CBT helps individuals to recognize and reframe distorted beliefs about themselves and their worthiness. Therapists guide clients in exploring the underlying thoughts and emotions contributing to the shame and teach coping skills to manage these feelings more effectively. So by challenging cognitive distortions and developing healthier thinking patterns, individuals can reduce the shame and improve their self-esteem. For example, a person experiencing shame due to a past failure may engage in CBT to challenge beliefs such as I am a failure or I'm unworthy of love and acceptance. So through CBT techniques such as cognitive restructuring and behavioral experiments, this individual learns to replace those negative beliefs with more balanced and realistic thoughts, leading to reduced shame and increased self-confidence. Then there's mindfulness-based therapies, such as mindfulness-based stress reduction, MBSR, and mindfulness-based cognitive therapy, MBCT, that incorporate mindfulness practices to cultivate present moment awareness and self-compassion. These therapies help individuals develop non-judgmental acceptance of their thoughts and their emotions, including feelings of shame. So by practicing mindfulness, you learn to observe your experiences with kindness and curiosity, rather than getting caught up in self-critical thoughts or avoidance behaviors. And this fosters a greater sense of self-acceptance and resilience in the face of shame. For example, a person struggling with shame may participate in mindfulness-based therapy to cultivate self-compassion and acceptance of their inner experiences. So through mindfulness practices such as meditation and body scanning, you can learn to observe your thoughts and your emotions without judgment, allowing them to acknowledge and process the feelings of shame with greater equanimity and self-kindness. And lastly, I want to talk a little bit about schema therapy that integrates elements of cognitive behavioral, psychodynamic, and experiential approaches to address deeply ingrained patterns of thinking, feeling, and behaving, known as schemas. In the context of shame, schema therapy helps individuals identify and challenge maladaptive schemas related to self-worth and interpersonal relationships. So therapists work collaboratively with clients to explore the origins of these schemas that are often rooted in early childhood experiences and develop strategies to meet unmet emotional needs and heal relational wounds. By addressing underlying core beliefs and emotional triggers, individuals can reduce the shame and cultivate healthier self-concepts and relationships. For example, a person with pervasive feelings of shame may undergo schema therapy to explore underlying core beliefs such as I am defective, there's something wrong with me, I am unlovable. So through experiential techniques such as imagery, rescripting, and chair work, this individual works with the therapist to challenge and reframe these negative schemas, fostering a greater sense of self-compassion and acceptance. So that's a mouthful about shame. It's something we all experience from time to time and relatively easy to resolve as long as we are open to the possibilities. I'm Sinta Ebersohn, and I invite you to get up and grow with me.